Hello again. We're going to start today with chapter 8. We're going to start just looking and talking about what we're going to be discussing this chapter. First of all, we're going to talk about the organs of the respiratory system and just a little overview, because you may not totally understand diseases unless we just do a tad little bit of an overview of each system. We're going to talk about the bronchial tubes, the larynx, the lungs, the nose, the pharynx, and the trachea. So if you will look, I'm starting on page 172. This is where we're going to get started. So the primary function of the respiratory system is to mainly get to produce air with the lungs, and that's a involuntary muscle that we use. The major organs of the respiratory system are the nose, and the nose is how we one way that we can breathe. The pharynx, the larynx, and so the pharynx is it's kind of like our vocal cords or our voice box. Larynx is like if you have laryngitis, you may you know what, I may have just gotten this confused. The larynx is like your voice box. Your pharynx is kind of like your throat, and that is part of the respiratory system because that's how we get air in our system. The trachea, the bronchial tubes, which are in the lungs, and then the lungs. So the trachea is kind of in between the pharynx and the larynx in the lungs. It's kind of right in the middle. So these all function together to create a respiration. Let's see. So if you want to, on slide 10 is a good video showing how the respiratory system works, so definitely watch that if you can. So the body cells that require a constant exchange of fresh oxygen with carbon dioxide, and if your body is unable to rid itself of carbon dioxide, that can be very, very dangerous. The respiratory system works in conjunction with the cardiovascular system. If there's something wrong with the heart, let's say if we have tachycardia, which is rapid heart rate, sometimes that can cause a rapid breathing, which are rapid respirations, which is called tachypnea. And then vice versa, if we have a slow heart rate due to something else, that can lead to a respiratory condition called bradypnea. So the process of respiration has to be continuous because, again, it's involuntary. We do it constantly, so it has to happen continuously. Let's see, slide 12 and figure 8.1 in the chapter shows you the respiratory system. It shows you the trachea where the air moves through, and it shows you the little sacs at the bottom of the bronchial tubes called the alveoli, and these are air-filled sacs that have capillaries wrapped around it, and those are alveoli. So let's talk about three distinct parts of respiration on slide 13. We're going to look at ventilation, inhalation, and exhalation. So ventilation is the flow of air between the outside and the lungs. Okay, so if there's not a lot of air in a place, we're not going to get enough air in the lungs. Inhalation is when we inhale, so the flow of air into the lungs, it brings us fresh oxygen, and then we exhale and we have a flow out of the lungs, and that gets rid of the carbon dioxide. And if there's not that exchange, if that exchange doesn't happen, it can lead to serious consequences. So going into external respiration, this is exchange of oxygen and carbon dioxide in the lungs. The gases diffuse in opposite directions. The oxygen enters the bloodstream and carbon dioxide leaves the bloodstream. Oxygen enters the bloodstream and carbon dioxide leaves the bloodstream. Internal respiration is when oxygen and carbon dioxide exchange at a cellular level in those alveoli sacs. They're delivered to the tissues, and oxygen helps us have metabolism. The more oxygen saturation we have, the better metabolism we'll have. and this is referred to as tissue breathing. If tissues do not have oxygen, they'll die in it and get necrotic, which means dying or tissue death. So if you look at figure 8.2 on page 173, you see this is the exchange of gases between the lungs and the blood. So you have the vein down here at the bottom, and you can see the cells right here. And then you have one alveoli right there. And so you're getting an air from the environment into the lungs, into the bronchial tubes, and then finally into the alveoli. And then carbon dioxide comes up from the capillary vein to the alveoli and then exhaled through the mouth. So that shows you a good diagram of how the exchange works. So let's look at the nose, the nasal cavity. This is the beginning of the ventilation process. Air enters the nasal cavity through the nostrils. The nasal cavity is divided by the septum, and some people may have a deviated septum. That's a very common problem that can cause snoring. And this is the cartilage that's inside of the nose that divides it in half. The palate and the roof of the mouth separates the nasal cavity from the mouth below. So that's why sometimes when you have a runny nose or sinus drainage, you will feel it in the back of your throat because it is connected with that palate and the roof of your mouth. The walls of the nasal cavity and the septum are made up of flexible cartilage, and it's covered with mucous membranes. And it is also covered with cilia. And the cilia and the mucus, or what we refer to as snot, will try to trap the bacteria and try to help us not to get an infection of any kind. And sometimes it works and sometimes it doesn't. But the mucus cleans the air by trapping the dust and bacteria, and then, like I already said, the cilia, which is the small hairs, will move around and trap the bacteria as well. The capillaries and the mucous membranes warm the air because sometimes when it's very cold outside, we don't want to get cold air in our respiratory system. So the capillaries help blood supply to the nose and it warms the air. And then we have paranasal sinuses, that are located in the facial bone. So you have sinus orifices all through your eyes. That's why when you have sinus infection, you may feel pressure behind your eyes, pressure in your teeth, pressure in your face. So that can definitely happen with sinuses. And when sinuses get completely congested, it can cause a lot of facial pain. If you look at figure 8.3 in your book, which is on page 175, it shows you the paranasal sinuses there, so you can see all those sinus channels and why it causes so much pain when you have an infection. If you have otitis media, which is an ear infection, obviously that's in the ear, but you have the eustachian tube that travels down here, and it can cause sinus pain or lymph node enlarging. Let's see, if you have chronic or acute sinusitis, that can cause pain mainly up in here, of course in the nose. Any kind of upper respiratory infection can cause that, like allergic rhinitis or some kind of viral or bacterial infection. Pharyngitis and tonsillitis are in the back of the throat. Laryngitis is more right here. Laryngitis usually doesn't have any more symptoms besides just loss of voice, and usually that's accompanied with pharyngitis or some other type of disease. And then we may have tracheobronchitis or regular bronchitis, and then of course we can have pneumonia, and there's all kind of other diseases that we're going to talk about. So that's what that figure shows you. Let's look at the pharynx. I'm going to flip back a little bit and talk about the use of the pharynx. This is as the air enters the pharynx or throat, which is used by the respiratory and digestive system. That's what the pharynx is used for. At the end of the pharynx, air enters the trachea, and then food and liquids are shunted into the esophagus. Sometimes you may swallow the wrong way, and it can go through the trachea into the windpipe, which is the same thing as a trachea, and get in your lungs, and it can cause a lot of coughing or choking. And I'm sure that's happened more than once to everybody. The pharynx has 3 parts, and it's a little 5-inch tube. We have the nasopharynx, the oropharynx, and the laryngopharynx. So, and then we have 3 pairs of tonsils that go along with these. And tonsils are a type of lymph tissue. And tonsils and any kind of lip tissue are used to keep out pathogens. So we have the adenoids, we have the palatine tonsils, and then we have the lingual tonsils. And we're going to go into that more. I'm trying to see where that is here. I can't find it offhand in your book where it is, but it is in your book somewhere. The larynx is also called the voice box. It's a muscular structure, and it's between the pharynx and the trachea, as I told you before, and it contains your vocal cords. So you may have heard the news about the singer, I can't remember her name now, but Adele, that's what her name is, and she had vocal cord surgery. And most of the time when there's something wrong with a vocal cord, it usually happens in singers, but they're singing the wrong way. They're using their throat instead of their diaphragm, and that can injure the vocal cords. The epiglottis, which is that little thing that hangs down in the back of your throat, in the middle of each tonsils. So it's a little flap of tissue. It sits above the glottis. It keeps food and liquid from being inhaled to the lungs. So it's supposed to move back and forth to shunt the food into the esophagus rather than the pharynx. It covers the larynx and the trachea during swallowing. That's a good thing, but of course sometimes it can mess up and you may get a little food or liquid into the lungs, especially if you start laughing and increase your breath real fast. Sometimes it will get into the lungs. And then we have the Adam's apple, which is mainly in males, but occasionally you may have females that have Adam's apple too, and that's the thyroid basically. Okay, the trachea. The trachea is also called the windpipe. It's a passageway for air and it extends from the pharynx and larynx to the main bronchi within the lungs. So it's about 4 inches in length. The trachea is composed of smooth muscle and cartilage rings. It's lined with mucous membranes and cilia, again, to try to keep any kind of bacteria out of the way. It assists in cleansing, it warms, and it moisturizes air. If you've ever had dry sinuses, you know how painful that can be. And so the trachea's job is to keep the larynx lubed so we can breathe and swallow, and it will moisturize air so it's not as painful to breathe. Then we have the bronchial tubes. These are formed by the division of the distal end of the trachea. You have the lungs right here, and then the bronchial tube comes in and goes into each lung, and then you have the bronchioles after that. So we have the left and right main bronchi, and then each bronchi, or bronchus is what we call it, enters one, and it branches to have secondary bronchi. And each secondary bronchi becomes more narrow to form the bronchioles. So it's kind of like a tree, the limbs on a tree, or when you look in the lungs, a picture or an illustration of the lungs, it may look like a root below the ground of a tree. So the function of the bronchioles, the bronchioles, what they do is they end with the alveoli, and the alveoli, like I said, are those little air sacs where the exchange of carbon dioxide and oxygen happen. You have about 150 million alveoli in each lung, and then we have a network of pulmonary capillaries which encase each alveoli, like I told you before, and that's considered the respiratory membrane. Okay, external respiration is the exchange of oxygen and carbon dioxide between the air within the alveolus and the blood inside the capillaries, and it takes place across the respiratory membrane. So that whole thing around the alveoli is called the respiratory membrane, because that's where the most important function of respiration happens. Okay, and then looking at the lungs as a whole, we have 2 lungs. You have a right lung that has 3 lobes, and your left lung has 2 lobes. So a lot of times when you have respiratory illness, sometimes it may only happen in 1 or 2 lobes in each lung, like pneumonia. You may only have it in 1 lobe. And you know, if you look at an x-ray report, it may say pneumonia left lower lobe. So it can happen in 1 or more lobes. It doesn't necessarily mean it's affecting the entire lung. The lung has the collection of the bronchi, the bronchioles, and the alveoli. All that is contained in the lung. And you can actually only have one lung if possible. You can survive with one lung. The lungs are spongy because they do contain air. They're protected with the ribs. That's the whole purpose of ribs, is to protect the heart and the lungs. And it's protected internally by the pleura. So if somebody has like inflammation of the fluid surrounding the lungs, they may have pleurisy, and that can be very, very painful. So let's talk about the pleura a little bit more. This is a parietal pleura, which is the outer membrane, and it also lines the wall of the chest cavity. Then we have the visceral pleura, which is the inner membrane, and it adheres to the surface of the lung. So usually if we have pleurisy or pleuritis, we have inflammation of the parietal pleura more commonly. The pleura is folded to form a sacra on each lung, and that's considered the pleural cavity. And we have fluid in that cavity that lubricates the lungs from expanding and shrinking back up. The respiratory muscles, the main respiratory muscle we're going to use is the diaphragm, which supports the lungs. It's right underneath the lungs, and it separates the abdominal cavity from the thoracic cavity. So the diaphragm is going to move up and down as we do things and as we speak. When you sing or you're a professional speaker, they say to use the diaphragm more because it supports your voice more and it becomes more stronger. Your voice can sound stronger, mainly. Let's say intercostal muscles. These are muscles that are in between the ribs, and they assist your lungs for expanding to inhale. And what they do is they raise the rib cage to enlarge the cavity to let your lungs fill totally up. So when you inhale, you notice your chest becomes more pronounced, I guess you would say. And then when you exhale, the intercostal muscles go back in, then your rib cage returns to normal. The lung volumes and capillaries. It's important to know the lung capacity and the volume of air that's actually flowing in and out of the lungs. And what we do to measure this is called a spirometer that we'll talk about in a little bit. Excuse me. So let's talk about measuring respiratory rate. Respiratory is one of the 4 vital signs. Really important to not only count the rate of inhalation and exhalation, but to listen for any noises and to listen or feel for the depth of the inhalation. Like, is it natural or am I going, trying to really struggle for breath? So it's really important to not only listen to or watch the rate and listen to the rate, but listen for extra sounds and how much muscle the patient is trying to use. Carbon dioxide, that's the respiratory rate depends on the carbon dioxide in the blood. So if the carbon dioxide in the blood is high, a person will breathe more rapidly, and then of course if it's low, the respiratory rate will also drop as well. Alright, so one thing that you definitely need to know is on slide 37, and this is the groups of the different respiratory rates for ages. Newborn, 30 to 60 respirations per minute, and 1 respiration is including 1 inhale and 1 exhale, not 1, 2, 3, 4. We don't do that. It's 1, 2. So that's how you measure it. So you have 1-year-old, 16-year-old, and an adult. So make sure you remember those. If you look at slide 38, this shows you a meter dose inhaler video, and so it's really good to use. It shows you how to properly use one. Then the next slide, you can see an asthma patient, like a little illustration video of that. Then the following video shows you an actual video of a man getting his physician is listening to his lungs for asthma. Then you have another animation of asthma on the next slide. Then the following slide, there's a lot of videos, talks about assessing respiratory rate. Then the next slide shows you how to do a tuberculosis test and analyze the results. So let's talk about common symptoms of respiratory diseases, and I'm on the bottom of page 173. Symptoms obviously are going to be breathing irregularities, so we're going to have dyspnea, which is painful respirations, tachypnea, which is rapid breathing, and wheezing. And then we can also have bradypnea. I also gave you that one that you need to know. And wheezing. Coughs can be productive or non-productive. Non-productive means they're not producing phlegm or mucus, and so it's a dry cough. When they're productive, that means they are producing phlegm or mucus, and it's called a productive cough, but usually due to chest congestion. Then we may have hemoptysis, which is coughing blood. Cyanosis is another symptom of respiratory disease, and this is where the patient turns blue. His skin and nails may turn blue. Nails may go first, and then sometimes the face will go next, and the skin around the extremities will turn blue, and it's lack of oxygen. Of course, fever is one of the big signs there of bronchitis, upper respiratory, lower respiratory infection. You can have fatigue due to labor breathing, and you may have less sleep, maybe coughing at night. You may have pain. Sinus pain, you could have congestion or throat pain that can cause a lot of painful breathing. You may have sinus drainage, which includes nasal drainage. You may have weakness, muscle aches. You may have weakness in your voice as well. So let's flip on over to page 174 and talk about the diagnostic procedures in the respiratory system. One of the ones that we do a lot is the bronchoscopy, and this is where we go into the lungs with a scope to see the structure and how it's working. Of course, we can do chest x-rays to tell a lot of diseases, and when warranted, we can do a fluoroscopy, and this is where we enter dye, and it shows us the visualization of the lungs and the diaphragm when we're doing breathing in and out. So that one shows a pretty good bit, but you have to have a pretty good diagnosis in order for insurance to pay for that. Some other things we can do are CAT scan, MRI, augmented chest x-rays. Like you may have heard of chest x-ray, PA and lateral, which is posterior-anterior and lateral. So it visualizes the lungs at different depths and things. Arterial blood gas, or ABG, is commonly done. This is done by taking blood. They get a needle, go straight down into the radial artery, and then they get the blood from there, because we need to assess the blood gas, and we need to see how the exchange of carbon dioxide and oxygen is doing, and so that's why it has to be taken from an artery. That procedure is pretty painful. The physician may also do a blood pH to see, if the pH of blood is good, and sometimes that will tell us if there's some kind of issue going on with the exchange of oxygen and CO2. Sputum examination is also helpful for bacterial types of things, and cancers as well. Gram stains, these in cultures, this can help us tell what kind of antibiotics are resistant to the bacteria that we're dealing with, and it'll tell us what antibiotics are sensitive to whatever we're dealing with. So it's really good to make sure that the physician changes the antibiotic if they need to, so the patient can get well, because some antibiotics may work and some may not. Spirometry, I told you we would talk about that. This is a type of pulmonary function test, and this measures the amount of oxygen you take in when you inhale, the force that you blow out, and then the leftover oxygen that's in the lungs. And so it does all those flow rates and tells you all that. If you look at slide 49, it shows you a video of how to do spirometry. So I want to start on page 174 with upper respiratory diseases now, since we've kind of gone through the function of the respiratory system. Obviously the most common disease is a common cold, so we're going to talk about that. I do want you to, when you get a chance, I want you to look at PowerPoint slide number 52. This is a video on allergic rhinitis, so it's another good video. Okay, so the common cold, one of the most common things that happens to us. So there is, the reason why there's not really a cure for the cold is because it's got over 200 strains, and probably way more than that now, of the common cold virus. And the cold is also called coryza. That's the name of the virus that causes the cold, and there's tons and tons of strains. Let's say the children or infants and the elderly are going to be the most common to get the more severe strains, because they're going to have weakened immune systems. Having colds, you know, even if you get the same strain, it's not going to make you immune to it, to where you don't get it again like most diseases do. Like when you get chicken pox, usually you do not get it again. You're immune to it. But colds are not like that. And of course the cold is contagious. So a cold is an acute inflammation of the mucous membranes lining the upper respiratory tract. The initial stuffed up feeling is a very common thing. It's caused by the swelling of the mucous membranes, which narrows the air passageway. And a lot of people think I have a stopped up nose from all that mucus in your nose, but actually the majority of time it's inflammation of the membranes. And so if you take an anti-inflammatory such as Advil or Aleve or something like that, it can reduce the inflammation in your nasal cavity and cause you to breathe a lot better. Let's say there is no cure for the common cold. Obviously we can do bed rest, clear fluids, chicken noodle soup, grandma's chicken noodle soup. One thing you don't want to do in children is to let them take aspirin, because aspirin can cause Reye's syndrome, but you can give aspirin for adults if needed. Antihistamines like Benadryl, Dimetapp, something like that will work as well. Coughing will help clear the irritants and clear the mucus out of the way. Also, you know, really sniffing and trying to get rid of the mucus will clear that out of the way. Occasionally you may have a secondary infection because of the cold, and so you may get sinusitis, a bacterial infection, where your sinuses are really bad, and it may cause a fever. And in this case, then you would need antibiotics if it's caused by bacteria, and that usually happens. You may have a cold for a couple weeks, and then you may get some kind of secondary infection, and all of a sudden you start getting a fever, you're nauseous, extremely fatigued, and body aches, and so that can happen, and that's when you need antibiotics. But other than that, the common cold, you do not need antibiotics. Let's see, sinuses and sinusitis. Let's go on that on page 175. The paranasal sinuses drain into the nasal cavity, which drains down the esophagus. These cavities are named by the skull bone in which they are found. Like we had the frontal skull bone, the ethmoid, the maxillary, and the sphenoid. So these sinuses are named by whatever skull bone that they are beside. With sinusitis, the mucous membranes that lines the cavity causes a sensation of pressure when it becomes really inflamed, and it can cause headache and cause toothache. Children usually have the ethmoid sinus that causes the ear infection, or fluid on the ear that can cause ear pain. So ethmoid sinus in children is more common because of that. Treatment for sinusitis: if it's a virus, we can't do anything for it except treat the symptoms. It can be allergic sinusitis, and we can treat it, with antihistamines and things like that. If it's bacterial, then we need an antibiotic. So bacteria is the only really thing that we can treat. Anything bacterial we can do antibiotics with. Environmental conditions can make your sinuses act up. When the barometric pressure changes, like right before a storm or right before rain or after a storm, it can cause sinus pressure. An airplane flight, the pressure can change, and that can cause sinuses to act up. Swimming can cause a stuffy nose. Sometimes when you're indoors and you're sick, you may have that. Somebody may come in and say that the house has that sick smell, and that sick environment can cause an increased stuffy nose. Tooth extraction or dental work. With environmental conditions, we can have tooth extraction, or dental work. Abscesses and allergens. Sinusitis is infection of the sinuses, can be caused by nasal congestion blocking sinus drainage. So tooth extraction can cause something to happen. Dental work, any kind of abscess, allergies, all those can cause sinus infection. So let's see. Some of the symptoms of sinusitis is a viscous discharge, which is a very thick yellow or greenish discharge. And when it is yellow or green, that's usually an indication that it's a bacterial infection and needs to be treated with antibiotics. If it's clear, it's usually allergic reaction or something like that. You can confirm the diagnosis of sinusitis by observation of the patient, a nasal x-ray. You can do a sinoscopy if needed, but that's not really needed unless somebody has chronic sinus infection. Discharge samples may be sent to a laboratory to look under the microscope with as well. Treatment, we can do decongestants and antihistamines. We may need antibiotics for the bacterial ones. And then some patients have to have surgery to have their some of the sinuses removed or open if it's blocked. It just depends on the type. So let's go on to the next topic in the book, and that's nasal polyps. And that's on page 176. Nasal polyps are non-cancerous growths. So remember, they're non-cancerous. They are not cancerous. The exact cause of the growths are unknown, really. They can cause a lot of pain in the nose, a lot of stuffy nose. You think you have a stuffy nose, but it's actually a polyp blocking the airway. So certain chemicals found in the environment are believed to cause, suggest maybe that it can cause a polyp. Let's see, nasal polyps form along with a sensitivity or an allergic response to an item, mainly aspirin. Okay, individuals with asthma and chronic rhinitis are susceptible, as children with cystic fibrosis are susceptible to nasal polyps. And again, they are non-cancerous. Large polyps can cause nasal drainage, interfere with your smell capabilities, and on rare occasions may be linked to obstructive sleep apnea, to where you're not getting enough oxygen during sleep. The treatment for this is surgery to remove the polyps, but usually a lot of people will not remove them unless they just become unbearable. Some other treatment to use is nasal sprays with cortisone, for instance like Nasonex or Flonase. Any of those would work good. If you do have surgery and it clears the passageway, it may not prevent the uncertain cause of the internal nasal lump. So that's why a lot of people may not have surgery, because if there's something going on around you that's causing it in the environment, you may just keep getting them again and again and again. So some people just live with them until it's unbearable. So let's go on to obstructive sleep apnea, which is the main cause of snoring. This is the most common sleep disorder. Apnea means a total cessation of breathing. usually most commonly during the night, to a non-foreign obstruction like an inhaled object, but caused by enlarged parts, nasal polyps, or a uvula, like a large uvula, displaced parts like a deviated septum, or any kind of fatty tissue that's in the nose or in the throat. All of these can cause obstructive sleep apnea. This usually starts happening in middle age, and is that in overweight males. It says just males in your book, but it can happen in females too. But you've noticed it now, more commonly now in younger people mainly. So individuals, patients, when they wake up, they're tired, they don't feel like they've slept good, they don't have any energy, they feel drowsy most of the day, they don't function very good, and so this is a very strong clue that you could have some kind of apnea. 4 or 5 sleep episodes of sleep apnea, or an hour, is about normal for a patient that has obstructive sleep apnea. 20 episodes per hour is severe, and these people have to use what's called a CPAP machine, which we'll talk about in a little bit. And if you look, here's the CPAP, the continuous positive airway pressure apparatus. If you look on slide 74, figure 8.4 in your book, if you're looking at your book, you can see that you can see the CPAP machine. It is quite noisy, so you know your partner may not appreciate the CPAP usage, but it will keep you breathing and help you become more not as tired, basically. And then the next slide shows you a video of sleep apnea. So, symptoms and treatment of sleep apnea. Well, one thing, like I already told you, will cause heavy, long, and loud snoring, and it may even cause snorting during sleep, or sometimes during the day as well. Researchers have found that during this interruption, decreased blood flow to the brain has occurred, and so that can be pretty dangerous. If you have an upper airway block, lungs do not fill properly, which creates a pressure in the chest that compresses the heart and reduces blood flow. So cerebral stroke, which is a stroke, like a regular stroke, is increased because we're not getting oxygen to the brain. Let's see. Treatment begins depending on the case. If it's weight, obviously they need to lose weight and see if it helps. If it's some kind of sinus issue or nasal issue, then we need to give them symptoms to decrease the inflammation in the sinuses. If they have a swollen uvula, then we may have to have a pharyngeoplasty, which means they will trim the uvula to make it shorter so the patient can breathe better. And that's usually a major cause for obstruction. Then you may have a deviated septum, which can be surgically fixed as well. Let's look at hay fever on bottom of page 177. This is also called seasonal allergic rhinitis. It's characterized by sensitivity to airborne allergens, especially pollens, ragweeds, grass, anything like that. So when this happens, we have a very runny nose, and it's mostly clear fluid. We may have congestion, nasal congestion mainly. You also may have problems with the eyes. You may have runny eyes because of the allergies. It may be have some redness in the eyes. You may have itchiness around the eyes, or tender skin around the eyes due to the drainage. When this happens, we release a histamine that causes all of these effects to happen. And so we want to give an antihistamine, which counteracts the histamine in the body. Flonase is a good medication for this condition, but we only want to use these nasal sprays on a short-term basis, because if you use it long-term, you can get rebound congestion, which is basically you think that it's helping your congestion, but you're using it so much it's actually causing more congestion. So you don't want to use Flonase, Nasonex, anything like that on a regular basis. Many hay fever people will take allergy injections to kind of desensitize themselves to the allergies. Maybe it's ragweed pollen, it could be dogs, cats, anything like that, pet dander, any kind of pet dander a lot of people are allergic to. So basically what you're doing with the allergy shot is you're desensitizing yourself to that allergen. So it's going to contain a small amount of the allergen in each allergy shot to keep you, and it's going to build you up so that doesn't cause a problem in your life anymore. Okay, going on to tonsillitis, pharyngitis, and laryngitis. These are all upper respiratory infections, and this is when they become infected, usually with virus or bacteria, and every once in a while it can be something else, but usually viral and bacterial. This can lead to sore throat, difficulty swallowing, fever, again, it's loss of voice, so there can be a lot of things with this. So we're going to start with tonsillitis first. And the tonsils are located on each side of the throat. They are lymph tissue, and they are there to help keep bacteria away. But a lot of times they trap bacteria and get inflamed and cause strep throat. So when you do have tonsillitis, they become very swollen and tender. It can cause difficulty in swallowing. And then usually when a lot of people have a lot of tonsil infections, we recommend a tonsillectomy and usually an adenoidectomy. And two, if a lot of people have a lot of ear infections, we may remove the tonsils because it's so close to the eustachian tube that the bacteria will travel down and infect the tonsils. Okay, so if you look on figure 8.5, you can see the tonsils there. You have the uvula in the middle, and on the right side it shows you a swollen tonsil, what it looks like. So you can see it blocks the airway a pretty good bit. Going on to pharyngitis. Pharyngitis is inflammation of the pharynx. This is basically another word for sore throat. This can happen from a foreign object being in our throat, hot liquid, very, very cold liquid, spicy food, GERD, which is gastroesophageal reflux disease, can irritate the pharynx as well. Breathing through the mouth only can irritate the pharynx because it's catching all the bacteria, and you don't really have much devices back here to catch the bacteria like we do in our nose. So, and it's going to dry out basically everything and cause a lot of pain. Pharyngitis, strep throat, one of the big things that can happen. This is caused by the streptococci bacteria. It's very common, and it results in a red purulent throat. Purulent meaning pus or mucus. So the presence of bacteria in the throat can be confirmed with a throat culture. We usually do like a rapid strep test to determine if the patient has a streptococcal infection. Treatment is antibiotics to treat it, and usually we give Zithromax, amoxicillin, something like that. Now, laryngitis is inflammation of the larynx, which can cause loss of voice mainly, or hoarseness. That's really the only thing that it can cause, but it happens a lot with pharyngitis because of the swollen tonsils can change the sound of your voice. Bacterial infections can sometimes cause laryngitis, so if that happens, then we do have antibiotics. Now, sometimes we can have a severe laryngitis that's caused from a bacteria that is, or a virus called croup, and that's where you have like the barking cough that children get a lot. And so this can really only be treated by resting your voice, drinking lots of hot fluids, staying in the bed, doing like a steam inhalation to lubricate the sinuses in the throat. So the more severe form of laryngitis is called croup. Now, the last thing we're going to talk about in this video is influenza, which is also called the flu. A flu is a viral infection. There is no cure for it. Okay, all viruses, in most cases, there's no cure, but there's things that we can do to shorten the time of the virus. Let's see, the onset of the flu virus comes very sudden. What you're going to feel is chills, you're going to feel fever, you're going to feel extreme fatigue and body aches, cough, sore throat, runny nose, chest congestion. You may even have stomach issues like constipation, diarrhea, nausea, or vomiting. So it's kind of all these symptoms rolled into one, and it's pretty miserable, which I'm sure most of you have had the flu. There's a ton of strains of the flu, just like there's the common cold, and we try to catch those flus. In fact, this year the flu shot that we give is taken, is made from what we saw last year with the outbreaks of flu. That's how they make the flu vaccines. So just because you get a flu vaccine, it may not protect you from all strands of the flu. The flus can get pretty severe, like we had the H1N1 the last few years. That is pretty severe and even can cause death in a lot of cases. It can also cause pneumonia, and then it can cause, a lot of chronic. It can cause a lot of conditions that will last quite a while, or would be chronic, or it could even last a lifetime. So when we have the flu, it can really mess up the epithelium of the respiratory system, which the epithelium really protects us from invaders and from sickness. So with the loss of all this, we're going to get more upper respiratory infections. Pneumococci is a very common infection, streptococci, and staphylococci, which is the worst bacterial infection. These can all cause pneumonia in patients that have had a severe case of influenza. The treatment, again, there is no antibiotics. You cannot use antibiotics for the flu, so there is no cure. Sometimes the physician will give you antibiotics to try to help with any kind of secondary infections that commonly happen, like bronchitis or sinusitis. So they will give you antibiotic, but it's not to cure the influenza, it's to cure secondary infections. So the only thing we can do is bed rest, lots of clear fluids, aspirin, except in children, and Advil, things of that nature. Every year you can get the flu vaccine, and they're usually made before the season starts. October and November is usually the best time to get it, before the flu season really comes on strong. High-risk people, recommended for everybody to get it, but especially high-risk people that stay sick a lot, or that people that have autoimmune diseases such as HIV and AIDS, the elderly, children, because both of those do, again, like I said earlier, have decreased immune systems. And again, they do not cover all strains of the virus. So if you look at slide 96, this shows you a video on influenza. So we're going to stop here at this video and pick up the next one with lower respiratory diseases.